Sorry. Okay. All right. So, Dr. Ann, we just got a copy of your report that sort of compares the DOAs with the non-DOAs. First of all, can you just give us your overall reaction to this?
Well, one of the interesting parts of this analysis is that we're finding with the dead on arrivals, a higher proportion are of lower education, and that seems to be a distinct finding. And there's more who are dead on arrival that were unvaccinated compared to the non-dead on arrival cases. That's really what's jumping out at us right now with this data.
Yeah, let's start from the beginning. I think this was triggered when that couple came in within a week of each other, both dead on arrivals.
Right, that was in early July, and it was odd because they were both dead on arrival and they died within a week of each other. So it was really sad. And then we kind of had a couple weeks of a lull, and then we just kept seeing dead on arrival mixed in with some of the other deaths. And it really became concerning. This was back in early July where it started. And then in August, we started to see more. And that's where we alerted the Physicians Advisory Group, and of course the governor, and of course our director, and everybody in public health. And so we had two press conferences, one at the end of August and one in early September, to kind of alert the community about this, because at the time, monoclonal antibody treatments were available at all of the hospitals, and there's no reason, I mean, people could get the treatment right away. So we were trying to encourage people to watch out for their elderly family members or people with chronic conditions, and say, please get to the hospital. If your elderly family members are sick, even though they might not, look like they're have a flu or something, they might just be weak or dizzy or whatever. So after that, we've continued to see it. We haven't seen another one since last week. There was one last kind of case there. And so I was asked, because the CDC team is here investigating this with public health, it's a joint investigation. I was asked to run the data comparing the dead on arrival cases with the non-dead on arrival cases. So out of the cases from the 8th of July to the 18th of November, 19th actually, there have been 119 COVID-related deaths, of which 47 or 39% were dead on arrival. And so the analysis I'm presenting here includes all the deaths in 2021 with that have complete information, including death certificates. That's 125. And what we do see is, comparing the dead on arrival cases with the non-dead on arrivals, is that it's heavily skewing disproportionately with Pacific Islanders, Micronesians, and especially Chuukese. When you compare what we would expect, given the proportions of these groups in our population, we would expect it to be smaller, but it's disproportionately high. Chamorros and Filipinos, it's more what we would expect given their numbers in our population.
Okay.
Now, by sex, what we're seeing is it's heavily skewed towards males for both dead on arrivals and the non-dead on arrival cases, but even more so with the dead on arrivals. You know why? Men don't go to the hospital until it's too late, or the doctor, right? I don't know if that's true, but men tend to be more stoic than women. As a general rule, men have higher mortality, women have higher morbidity. By age, we're also seeing it's heavily skewing towards elderly people in both categories, the dead on arrival and non-dead on arrival cases, but there's more in the dead on arrival cases of middle-aged people, 40 to 59. And then of course we've had, there was 2 infants and a disabled teenager that also died dead on arrival. And then, so there are some differences here. Most of the cases in both instances are from the north, our most populated villages, but we see a slight difference with slightly more coming from the south with the dead on arrivals. Not sure why. If you want to compare any of these data with our cases, you can go to our website and look at the COVID dashboard. The other thing that's very striking is when you look at comparing the non-dead on arrival cases with dead on arrivals, 82% of the dead on arrival cases were unvaccinated compared to 58% of the non-DOA cases. So that's definitely a risk factor. And then the other thing we're noting is among the dead on arrival cases, they tend to have higher proportions in the lower educational levels. And for the non-dead on arrival, they're more likely to have actually completed high school or college. And that's coming from the death certificate, the educational level. I haven't looked at occupation or industry yet. I hope to do that next. And as you know, we're working with the CDC, who are still in data gathering mode on this project. Then if you look at chronic conditions with the dead on arrival and non-dead on arrival cases, we're seeing similar patterns with diabetes, hypertension, and then chronic renal or lung disease. I put this in here for obesity, smoking. Most of the risk factors are underreported for our cases as well as our deaths. It's just something people don't want to admit. And then looking at causes of death, we haven't seen anything very different from what we have reported before. Most people, whether they're dead on arrival or not, are dying of respiratory ailments associated with COVID, either acute respiratory distress syndrome or respiratory failure or COVID pneumonia or complications of COVID, and or cardiovascular events. And we do see diabetes, hypertension, cardiovascular disease, and renal disease showing up as contributory causes of death. And we saw this before. So that's just a preliminary look at what's going on as we continue to investigate this phenomenon with the CDC.
Yeah, Doc, what would you say would be your biggest takeaway from this preliminary data?
Again, the unvaccinated are much higher in dead on arrivals, and then of course the low educational level, which might mean lower health literacy. We do know that in the CDC investigation, we're looking at other issues like access to healthcare, if transportation is an issue, and that sort of thing. So we should get a lot more detail on this as this investigation unfolds in the next couple of months.
So in other words, to address it, would it be safe to say that you're encouraging vaccinations and you're encouraging people to become more knowledgeable about the threat of the disease?
Yes, and especially for specific groups, especially with our Micronesian migrant residents who are here, Chukis and Pohnpeian. They're disproportionately represented in both dead on arrival and non-dead on arrival cases. They're disproportionately represented in the deaths. So our messages might not be reaching them. And that might be something to, and we're planning to do a lot more outreach and to try to address some of these health disparities as we move forward. So it's obviously something that we're aware of. Yeah.
From these earlier days back in July, when we saw a lot more of these DOA cases, where are we at right now? Has that sort of tapered off?
Everything's tapered off. The number of cases has tapered off. The hospitalizations and ICU has tapered off. And the problem with hospitalizations and ICU and deaths is that it usually takes a little longer for us to see that tapering off, even as the cases decline, because some people are sick and they're in the hospital and they've been there for a month, et cetera. But we are seeing a decrease in cases, deaths, but and definitely in dead on arrivals, but it's not over yet. I'm hoping not to see, I don't like to see them. Yes, there's definitely been a tapering off in November.
Yeah, when you say it's not over yet, that just brings me to ask you about this new variant. What are your thoughts on that?
Well, it's obviously something everybody's concerned about and is watching, and we hope it's not here. I'm sure it's already in the US. I'm sure it's all over Europe and who knows where. It's obviously something we're paying attention to because we don't want to see another surge, right? All the more reason, get vaccinated. if you're not vaccinated, get vaccinated. We don't know if the vaccination will help against this new variant, but it certainly can't hurt, right? Get your booster if you haven't had your booster. And if you haven't gotten your follow-up shots, go in and get those. It's just really important, especially if you're elderly or if you have chronic conditions. It's the only weapon we have right now, because as you heard probably in the news, the Merck pill doesn't even work very well. And there aren't, treatments. And of course, they're researching this new variant to see if they can tweak the vaccines. Again, we've mentioned this before. It's probably something you're going to have to do every year, like the flu shot, right? Until we get a handle on coronavirus. And, viruses, it's just doing its job. It's replicating, right? And it's finding ways to survive by mutating, right? So.
Yeah, there apparently right now is no way to kind of stop it in its tracks other than getting all herd immunity. Will that stop it?
I think we need to, I've been saying this for months. We need to be at like 100% vaccination. I know that's a dream, but I think we need to get as close as possible. And this is something I was discussing with someone the other day. We've got to get vaccines to everybody all over this planet, because there's no way we can just vaccinate ourselves in the United States or wherever and think that something's not going to mutate and change it, because it's doing it as we speak, right? Coronavirus.
All right, Doc, thanks for the insight. Thanks for the information, and hopefully crossing our fingers that Omicron does not reach our shores. That's Dr. Ann Pobutsky, our territorial epidemiologist with more knowledge for us. Thanks, everybody.
Thanks.